I joined the nursing profession on the 8th of July in 1957. Even then, in the nursing profession, I in many instances, began a spokesperson for my class, for the nurses, and had to be amongst the first students to attend Nurses Congress, and got myself involved in professional issues by attending. The nurses professionally were beginning. It was just the time when they were dividing the branches according to race, and the branch where I belonged, the Unity branch for blacks in Johannesburg, had started in 1958, and I was in my first year of training. So I attended those meetings as early as all that. I didn't know that eventually I would lead that very branch as a chairperson. So my training was also very, very, very smooth. I passed all my years until I finished my training. I still remember I had problems here and there, especially with the sisters in the wards and so on, because I could speak my mind, and at that time as a nurse you had to just like the soldiers take instructions, and it ended there. I remember many a time when I would be reported to the matron-in-chief, and because of my progress at the college, I wouldn't be dismissed. I was given a chance, given another chance, and given another chance, and until I completed. But I remember when now I had finished writing and I had passed, and the matron was calling all the students who were to be given posts to work at Baragwanath. I was one of them, and the matron actually said, we nearly lost a very good nurse in you, and I'm happy to say I am giving you a post to work in Baragwanath Hospital. I worked in many sections until eventually I was allocated in children's wards, and there I felt I had to make my choice. I had to decide which speciality I would follow. I loved working in theatre, but the children's wards, these were quiet patients. These were patients you could see when they were really not well, and try and intervene and be a spokesperson for them. So pediatric nursing became my specialty, and I worked with children. I eventually did the diploma in pediatric nursing. Later on, as I was becoming senior, I wanted to be a charge person who knew what she was doing. I did a course in ward administration. It was called CCA&I, Clinical Care Administration and Instruction. And in that course I got the highest marks in the entire country. I wasn't really satisfied with that little part of administration, and I went further and did hospital administration. It's called nursing administration at the University of the North. Later on then I registered with UNISA, and I did a degree in nursing education and in community health, and went back to Baragwanath to work as a nurse. I had a turning point in my work as a nurse. 1986, I was then the chairperson of the South African Nursing Association branch, Unity branch, as I mentioned earlier. And we, unfortunately, in the hospital, had the first strike in the country for healthcare workers. The nurses had legitimate grievances, but unfortunately the matron-in-chief, who was a nun, didn't understand things very well. Like, for an example, as a nun, she expected young girls to just have supper and go back to the nurse's home, study and sleep. And she didn't understand that their boyfriends would be wanting to take them out and so on. So when the nurses went on strike, I led the nurses, the members of the South African Nursing Association, to intervene on behalf of our young nurses. In fact, the province reported them to the South African Nursing Council for disciplinary measures. And I actually felt the problem was not the young nurses only, it was also the management. I mean, at that time, it was a wrong thing for the matrons not to understand that young girls were young girls, and young girls had to have boyfriends. They had to grow up like any other young person. And I didn't know that by doing that I was jeopardizing my work situation with the Transvaal Provincial Administration. So I began having some problems. At one time, I would notice that I was being followed. I was taken as a person who was political, and yet this had nothing to do with my political beliefs. It was just, I felt as a mother and also as a professional person, I had the responsibility to protect the young nurses. To such an extent that when I realized that I was about to probably even lose my job, and the South African Nursing Association now was also looking at things a different way, we had challenged them. We had said to them, if they were saying they were protecting nurses, they had a responsibility to protect these young student nurses. And they were seeing our point of view. They then approached me to find out if I would take up a position with them. And I actually felt I was going to take the challenge as the first black nurse to be employed by the South African Nursing Association. I asked them to first give me a trial job. I would go to the office for a week to make a decision whether I was taking the job or not. I went to the office, and the very first day, a young colored professional nurse had been dismissed from work, and I felt it was not right. I didn't have much knowledge about labor relations, but I felt it was not right for her to be dismissed when she was sick. Then I took up the case and made the decision, informed the executive director of the South African Nursing Association that I was taking up the post. I knew even at that time that I would lose a lot from my pension, but my pension was nothing more than at least proving that black nurses could do what white nurses were doing, and also representing my black nurses in the South African Nursing Association. I therefore started working for the South African Nursing and as a professional officer, and I wanted to prove to my white colleagues that there was no way one could divorce labor issues from professional issues, and that I actually feel I was instrumental in changing the South African Nursing Association to becoming a professional body and also representing the nurses as a union. So the South African Nursing Association began registering as a union, and it had now two legs, a union leg and a professional leg. I then worked as a professional officer under managers who were white, less qualified than me, but I would take instructions from them until eventually I became the manager for the Transvaal. And I worked as the manager for the Transvaal up to my retirement in 1998.